Welcome to today's online teaching. My name is Nwajiaku Chinelo from Civic Department, St. Charles College, Onitsha. Our topic today is cervical and breast cancers. Before we continue, I would like us to look at our specific objectives. By the end of this lesson, the following are the things we are expected to learn. Number 1, define cervical cancer. Number 2, explain briefly the historical nature of cervical cancer. Number 3, list 8 risk factors of cervical cancer. Number 4, state 5 signs and 6 preventive measures of cervical cancer. Number 5, define breast cancer and state 6 main factors of breast cancer. Number 6, explain other risk factors of breast cancer and explain 3 methods of breast check, signs in the breast. And number 7, state 5 preventive measures of breast cancer. Now, cancer. What is cancer? We are talking about cancer, and we will look at it as an abnormal growth that occurs in the human body. That is cancer. It can occur anywhere. In the head, we call it tumor or brain cancer. In the blood, we call it leukemia. Any other place, cancer can occur in any part of the body. Now we are looking at cervical and breast cancer. First, what is cervical cancer? Cervical cancer is the cancer that affects the cervix. The cervix is the part of the female reproductive organ. It is also called the neck of the womb and is the narrow, lower part of the womb called uterus that joins it to the top of the vagina, just like a neck connects the human body to the head. Historical nature of cervical cancer. Cervical cancer is a cancer that affects the cervix. It is the 4th most frequent cancer in women worldwide. It is 2nd most common in developing countries like Nigeria, Ghana, particularly among women aged 15 to 44 years. Data from 2012 revealed that of the 445,000 new cases reported across the world, about 84% occurred in developing countries like Nigeria and the rest of it. In addition, of the approximately 270,000 global deaths from cancer, over 85% occurred in the same countries like Nigeria. In developed countries, effective screening and treatment programs prevent up to 80% of cervical cancer deaths. But these are usually not available to women in developing countries like Nigeria. As a matter of fact, most developed countries have widespread government-funded vaccination, screening, diagnostic and treatment programs for their women. In contrast, only 9 of 55 African countries have functional cervical cancer preventive programs, and Nigeria is not one of them. An unfortunate implication is that cervical cancers among women in Africa and other countries in the developing world are often not identified until it is in advanced stages, leading to the stated poor countries, in view of this, empowering women in these countries to look after their health and adopt cancer preventive lifestyle and identify early symptoms of cervical cancers and the realistic measures in the concerned countries. Risk factors of cervical cancer. When we're talking about risk factors of cervical cancer, we mean the causes of cervical cancer. They include the virus, that is human papilloma virus. This is the virus responsible for virtually all cervical cancer, all types of cervical cancer. And these causes include, number one, early age of first sexual intercourse, which is between the age of 5, 6 to 11 or 12 years of age. When a child is being exposed to sexual intercourse at between this age, the person may have the risk of having cervical cancer in future. Number two, having multiple sexual partners. It is also a way of exposing someone to the risk of cervical cancer. Number three, having many children. Having many children, usually more than 4. It is also a way of exposing one to the risk of cervical cancer. Number four, smoking. Number five, lowered immune system. For example, HIV-infected individuals are at high risk of HPV infections. That is, when the immune system is very low, it can no longer fight the germs or prevent the body from contracting diseases. The person have or stand the chance of having this cervical cancer. Number six, presence of other sexually transmitted diseases like gonorrhea, herpes, syphilis, and the rest of it. Know very well that when someone did not treat sexually transmitted disease very well, it may lead to this cervical cancer in future. Poor diet and poor hygiene. And the last of it, lack of regular cervical screening tests. Cervical cancer include the following. Number one, irregular and intermenstrual bleeding, bleeding between period, or abnormal vaginal bleeding after sexual intercourse. That is, when a woman sees her period 2 times in a week or 2 times in a month. Number two, avoid unprotected premarital sex. Number three, avoid sex with uncircumcised person or partner. Number four, promotion and provision of condoms for those already engaged in sexual activities, not for everybody. Breast cancer. Breast cancer is abnormal cell growth that occurs in the breast. In Nigeria and other West African countries, about 37 people out of every 1,000 women in a year, 3 to 4 out of 100 will develop breast cancer. Even though this is smaller than the 8 to 10 people out of 100 per year who will develop the cancer in countries from developed countries like Australia, Northern Europe, and North America. The death rate in West African and other developing countries are higher than in these developed countries. For instance, after 5 years of being diagnosed, only 1 person out of 10 will survive in a country like Nigeria, while at least 7 out of 10 will survive in Britain, Australia, and United States of America. In view of this, there has been a recent push to empower young teenage women from developing countries on ways to mitigate the risk of breast cancer. Risk factors of breast cancer. What are the causes of breast cancer? That's what we mean by risk factors of breast cancer. Number one, gender. A woman is 100 times more likely than a man to develop breast cancer. Man can also get breast cancer, but it is rare and accounts for less than 1% of all breast cancers. That is, it is more common, more frequent in women than in man. Number two, age. The risk of developing breast cancer increases with age. The majority of women with invasive breast cancer are over 40 years of age in Nigeria. That is, the more your age comes up, the more chances the person may have of getting breast cancer. Number three, genetics. Faulty genes that increases the risk of breast cancer can be inherited from one's parents. However, only about 10% of breast cancer can be inherited. And number 4, family history. Having a very close blood relative, such as mother or sister, who has had breast or ovarian cancer can increase one's risk. That is when someone in the family in the past have suffered this breast cancer, someone may inherit it, but it is not always the case. Then number 5, race, color. White women are slightly more likely to develop breast cancer than Africans, blacks, including Nigerians. And number 6, which is the final one, family personal history. People who have breast cancer have a greater chance of developing another cancer in the same breast or in another breast. Other risk factors of breast cancer include the following: starting menstruation at a relatively early age, before 11 years of age. Some people do see their period at the age of 8, 9, or 10. The person may have a chance of getting some breast cancer in future. Number 2, starting menopause, cessation of menstruation at a relatively late age, at the age of 55 years of age. Sometimes the fact that some people may like to keep taking injections or drugs that can prolong their menstrual cycle, thereby getting into menopause at a relatively late age. It is also exposing them to the risk of getting cervical cancer. Number 3, not having children at all, or having a first child after the age of 30 years. Not having a child or having your first child at the age of 30 years. The person may have that chance of getting breast cancer. Number 4, not breastfeeding. The more months spent in breastfeeding a baby, the lower risk of developing breast cancer. Breastfeeding is very, very necessary. Number 5, taking the combined oral contraceptive pill or taking the combined hormone replacement therapy, HPT, after menopause, especially when taken for 5 years or longer. That is what I just explained earlier. When some women take all these contraceptives or therapies to prolong their menstrual cycle, they end up getting into menopause at relatively late age, which may expose them to the risk of breast cancer. Then number 6, gaining a lot of weight in adulthood, especially after menopause. One has to watch your weight and watch what you eat. Number 7, sedentary lifestyle, lack of physical activities, and eating too much fat. Number 8, drinking a lot of alcohol, more than 2 standard drinks a day. And finally, smoking. 3 methods of breast self-examination. Number 1, bathing self-examination. 2, mirror self-examination. 3, lying down self-examination. Now, students, we are going to take them one after the other. Number 1, bathing self-examination. This is done while bathing in the bathroom. Place your right hand at the back of your head. Use your left hand to check the right breast, starting from the armpit. Move to the breast. Press round the breast to ensure there is no lump or pain round the breast. Do the same in the left breast by placing your hand on the head. Use the right hand to check the left breast. Mirror check. Stand undressed from the waist in front of a full-length mirror. Arms should be relaxed by the side. If one cannot stand comfortably, this part can be done while sitting. Just look at the breast. While sitting, just look at the breast and get to know how they look. Even small visual change, even small visual change may be significant early signs of problem. Compare both breasts by turning from side to side and looking for one changes in size, shape, skin texture, or color. Look for nipple changes like ulceration, itches, and the rest of it. The changes might include redness or rashes, as well as a skin dimple, puckering, or retraction, pulling back of your skin afterwards. Place hands on the waist and bow towards the mirror. Let the breast fall forward. Note, not any changes in breast shape, nipple discharge can be a sign of a problem, particularly if blood stained or if from one nipple only. Check for lumps or thickening in the breast or in armpits while relaxing the arms at the side. Such lumps can be well defined, or they may just feel firm or hard than other breast tissues. They may or may not be painful. Then the last, lying down. Place a pillow and folded towel under the left shoulder. This helps breast tissue to spread evenly across the chest wall. Bend the left arm behind the head and reach across with the right hand to the left breast. Again, a little skin cream or lotion on your fingers will make them more sensitive. Begin the exam at the armpits. The hand should move in straight rows to cover all the breast tissues from the line where the blouse seams would fall. Now, let us look at the preventive measures of breast cancer. Number one, do not smoke. Smoking is not good at all to the health or to the body. Number two, eat a healthy diet. Avoid fatty and sugary diets. Eat at least 5 portions of fruits and vegetables a day, more especially women when your age have come up, when you have come up to the age. Balance your food, eat more of fruits and vegetables. Number three, increase physical activities. Indulge in moderate intensive exercises, enough to make you either sweat or pause for breath for at least 30 minutes a day, 5 days in a week, at least 150 minutes a week. Very, very important. So sometimes we do work out, we do something that will make us to sweat or to pause breath. Then number four, maintain a healthy body weight. Body mass index of 20 to 25 is very, very necessary. You need to watch it and maintain that body weight. Do not allow yourself to overgrow or look fat and big. Then the last of it, avoid alcohol. Now students, we have come to the end of this lesson. I would like to evaluate you with the following questions. You will study it, solve the questions, and then forward your answers to my WhatsApp number. Number one, define cervical and breast cancer. Number two, mention 5 risk factors of cervical and breast cancers. 3, state 5 signs of cervical and breast cancers. Number 4, list 3 methods of breast self-examinations. Number 5, mention 5 preventive measures of cervical and breast cancers. Now, students, forward the answer to my WhatsApp number 080-388-69230. Thank you for listening.